Hello, I am Dr. Rachna Mazumder, consultant endocrinologist at Fortis Kidney Institute, Kolkata. Today, I am going to talk about the difference between type 1, type 2 diabetes and gestational diabetes. Essentially, there are two main types of diabetes, type 1 and type 2. Type 1 means there is no insulin in the body, it's very deficient, and in type 2, there is a lot of insulin in the body, but it is not able to work. Now, this is the basic, but how do we differentiate on the ground? The type 1 diabetes usually occurs in young people, children, whereas type 2 occurs in older adults, although we are seeing a higher incidence in children nowadays. The second is the build. Type 1 diabetes are usually thin or lean, whereas type 2 are generally obese, although we do see in thin and lean individuals also. The third is the onset. In type 1, it is like sudden, like a bolt from the blue. The patient gets sick and gets admitted to the hospital. Whereas type 2, often there is no symptom, it is just diagnosed by routine tests. The fourth is how we are going to treat it. In type 1 diabetes, we treat with insulin, which has to be given lifelong. Whereas in type 2 diabetes, we may give insulin, but usually that is depending upon the glucose control, but generally tablets are able to control in most of the cases. So these are the general differences between type 1 and type 2, although doctors can differentiate between these two conditions by doing some more sophisticated blood tests. So let us talk about GDM. GDM is gestational diabetes, which occurs in pregnancy, usually in the 24th week of pregnancy onwards, and this is diagnosed also by blood test, and this causes if it is not controlled, then the baby size is more, and that causes complications during delivery and after birth. Whereas a person, if it is type 2 diabetes before the conception and the patient has uncontrolled diabetes during the first few weeks of pregnancy, then that child is more prone to develop many organ anomalies. Whereas in GDM, it is a problem of size of the baby which becomes large and some post-operative complications after birth. Whatever it is, either type 1 or type 2 or GDM, it is very important to control the diabetes well, especially GDM. GDM has to be very tightly controlled. Of course, type 1 and type 2 also, better the control, the better is the organ function throughout life. Thank you.